treat me, you have to know who I am. I identify as a Latina lesbian mother.
To treat me, you have to know who I am. I identify as a transgender man.
To treat me, you have to know who I am. I identify as a gay man. I was diagnosed with anal cancer, and when I'm dealing with something medical, it's extremely important that they know who I am. Every doctor I've been to, and there were 7, all of the nurses, all of the assistants, everyone treated me with respect.
It is as important to know somebody's sexual orientation, and even more than that, what their sexual scenario is, as it is to know if they're getting a good night's sleep, or if they have a good appetite, or if their bowel movements are normal. It's all part of basic bodily functions that are required for a maximum quality of life.
It's important to have an open and honest relationship with your patient. And so if you do not know what their sexual orientation is or how they identify, that patient is not going to feel safe telling you everything that they need to tell you for their proper medical care.
Knowing a patient's gender identity and sexual orientation helps a practitioner to care appropriately for that patient. We see a lot of patients come in who may not be comfortable disclosing that information, and routine testing or screening may be missed for that patient.
When I was about 15 years old, I remember going into the doctor's office, and my doctor was very warm and very welcoming. She was asking me all the questions that she's supposed to ask to an adolescent, and I remember telling her when she asked about my sexual activity if if I use condoms or anything like that, and I said, no, I'm gay. And I just remember her face changed very much, and her warm tone of voice turned very harsh, and it seemed as though she was rushing me out as quickly as possible.
As a lesbian, unfortunately, when I've been involved with the healthcare system, it's usually hasn't been very welcoming.
Counseling needs and strategies for the LGBT community. It is fairly common knowledge that individuals who identify as lesbian, gay, and bisexual, transgender experience unique health disparities, particularly in the area of mental health. This presentation will examine LGBT mental health from a historical context, review strengths and strategies that exist within the subpopulation, and offer suggestions for counseling strategies and working with consumers who may identify as LGBT. This is a description of how individuals identify themselves. Lesbian and gay individuals are people who desire to have an intimate relationship with people who are of the same sex or gender. Bisexual are individuals who have a desire to have intimate relationship with individuals of the same or different gender. Transgender are people who identify and or express their gender as the opposite of their biological birth sex. It is first important to note that the LGBT community is comprised of individuals that represent distinct populations with differing health needs and concerns. Too often, the LGBT acronym is used as an umbrella term that does not acknowledge that lesbian, gay men, bisexual, and transgender individuals also have subpopulations based on race, ethnicity, socioeconomic status, geographical location, age, and other factors. While this presentation was created using various resources, including our text and journal articles, the preponderance of information derived from the 2011 report entitled The Health of Lesbian, Gay, Bisexual, and Transgendered People, Building a Foundation for Better Understanding. The report was commissioned by the National Institute of Health. This report covered many aspects of health-related issues to the LGBT community. However, my presentation will report only on those findings related to mental health. To understand the challenges faced by LGBT people, we must understand the historical context in which their lives have been influenced. We know that they have been stigmatized as sexual and gender minorities. However, there are also implications that involve laws and policies, demographic factors, and barriers to health care. The report explains the stigmatization of many non-heterosexual and gender variant individuals, which has its roots in the fact that homosexuality was included in the Diagnostic and Statistical Manual of Mental Disorders up until 1973. This shaped sexual minority patients' involvement with the healthcare system in a very negative way. The report also goes on to acknowledge how the laws regarding same-sex marriages impedes access to employers-sponsored health insurance, and how other barriers to health care include providers who have not been adequately trained in culturally competent care, as well as previous negative experiences with healthcare systems. Mental health findings from the report indicate that LGBT youth are at increased risk for suicide ideations and attempts and have increased risk for depression. Smaller studies indicate that this may also be true for transgendered youth. As a group, LGBT adults experience more mood and anxiety disorders, more depression, and elevated risk for suicidal ideations. This is true for transgendered adults as well, with the exception that little research has been done on mood and anxiety disorders in this population. The HIV/AIDS epidemic resulted in deaths of thousands of gay and bisexual men. At the same time, this created a resilience and more unified in the LGBT community. HIV/AIDS remains one of the most critical health issues related by some subgroups within the LGBT population in the United States, particularly gay and bisexual men and transgendered women. LGBT people are more often targets of stigma, discrimination, and violence because of their sexual and gender minority status. Despite the challenges that are faced in the LGBT community, there are also strengths that contribute to their quality of life. Sue, 2013, cited a statement from Singh and Chung, 2010, and Singh, Hayes, and Watson in 2011 as the following. LGBT people not only survive experience of oppression, discrimination, and prejudice throughout society, they develop considerable resilience, coping skills in the process of maintaining hope and seek social support. They are capable of creating and developing families of choice. They serve as positive role models. They report living authentically. They are involved in social justice and activism. They establish egalitarian relationships. The LGBT community relies on the strength of each other. When the HIV epidemic began in the late 80s, the gay population received the most ridicule from society. As a result, they had to depend on each other for support in so many different areas of their lives. As a counselor, there are certain strategies and perspectives that will assist us in providing services to this population. As a clinician, I must know myself as it relates to my strengths and weaknesses, becoming competent and compassionate for the people I'm serving, being able to provide in-service training to increase my knowledge base as well as my colleagues. I will locate those culturally specific theories that would be most beneficial to the LGBT population versus using the traditional white male model counseling theories. Being culturally sensitive to the needs of those being served is pivotal to establishing rapport and respect for those seeking treatment. It is very important for me and those I work for to have a good understanding of the professional, ethical oath signed and recognized, the commitment towards providing the best possible service to those that I will be serving. Keep in mind it is my responsibility to obtain, maintain, and update myself on the many different theories, challenges, and resources available to me as a clinician. To be sensitive to those I work for, I must remain open-minded, maintain unconditional positive regard, and not prejudge the client in any way. In the event that I come into a situation that is beyond my scope of practice, I will seek clinical supervision and move accordingly to service the individual promptly, effectively, and compassionately. I would then continue with supervision to ensure I look at the blind spots that I may have impacted my judgment and move towards addressing this immediately. Professional development is also important, whereas I will increase my reading of peer-reviewed articles, books related to my subject matter, and attend workshops and conferences to improve my counseling skill set. While working at an agency providing services to the LGBT community, I will encourage our team of professionals to continue to research and find out the best practice concepts used for this population and seek treatment in that area. And lastly, it would be extremely important to create and maintain a safe office environment with visual resources available to promote and provide a sense of healing to the client.